So hi guys, hope you're all very well. This is a presentation by myself, Shane McKay, Body Mechanics, and it's a COVID-19 first aid responders course presentation on how to deal with somebody who's become sick with COVID-19. This is the world we live in now. So I'm just going to share my screen now, and I'll pull up the presentation for you. Okay, so this is COVID-19 specific protocols for first aid responder, presented by myself, Shane McKay, FAR instructor. So after you've watched this recording, if you want to send me any questions, please do. That's no problem whatsoever. So the objectives of the presentation are to go through the SARS-CoV-2 COVID-19, how the SARS-CoV-19 infection may spread from person to person, how FARS can break the COVID-19 chain of infection, infection control standard precautions, hand hygiene techniques, when hand hygiene should be performed, how to select appropriate PPE based upon risk assessment, how to remove and dispose of single-use nitrile gloves. Continuing on, respiratory hygiene, cough and sneezing etiquette, providing CPR for patients in cardiac arrest, the Health Protection Surveillance Centre screening case definition for COVID-19, how the first aid responder can look after their own physical and mental well-being, precautions that must be taken when ventilating a patient using a bag valve mask, BVM, precautions that must be taken when oxygen is being delivered to a patient, avoiding oral and nasal suctioning if possible, particularly in confined spaces, caring for a patient with suspected confirmed COVID-19. So what is COVID-19? So what we know it emanates from SARS, which is a coronavirus, which is a large family of viruses that circulate among animals. Rarely they can jump and they can change and infect people and then spread between people. And of course, this is what's happened over the last 6 months. COVID-19 is an animal virus that has changed and is now infecting people. COVID-19 was declared a global pandemic by the World Health Organization on the 11th of March, 2020. We think now that it started maybe in November of last year or December in China, whichever you want to believe. A vaccine has not yet been developed. 3 major companies in the world now are working on it, so they're hoping the next year they will have them. Controlling the spread of the virus requires us to break its chain of infection. So how does it spread? It infects through contact with the mucous membranes. It does not infect through the skin. The greatest risk for responders transfer the virus to the mucous membranes by contact of contaminated hands, including contaminated gloved hands to the eyes, to the nose, or the mouth. Significant risk of direct transfer of the virus onto mucous membranes by droplet transmission. So obviously breathing aerosol, that's the worst or the quickest way that it can possibly transfer. Droplet transmission is most likely to happen if you are within 1 meter of the patient. Sneezing and coughing increases the risk of droplet transmission. So how do we interrupt the chain of infection? Through hand hygiene, using gloves, facial protection, wearing masks, a gown, prevention of needle stick injuries, respiratory hygiene and cough etiquette, environmental cleaning, linens, waste disposable, and patient care equipment. Hand hygiene. Hand hygiene by washing should be done 40 to 60 seconds. You wet the hands and apply soap, rub all surfaces, rinse hands and dry thoroughly with a single-use towel. Use the towel then to turn off the tap, or paper towels now. That's what you're using, paper towels, throw in the bin, dispose of it quickly. Hand hygiene by washing must be performed if hands are visibly soiled, exposure to spore-forming organisms is suspected, or after using the restroom. Hand hygiene by rubbing, hand rubbing 20 to 30 seconds, apply enough product, so like an alcohol solution, to cover all areas of the hands. Rub hands until dry. Hand rubbing must be performed with alcohol-based preparation. So a lot of common sense stuff there. The big thing is really looking at the hand contact, places where you've been placing your hand, what you've touched, all that kind of thing, who might have touched it beforehand, etc. So when you perform hand hygiene, before and after any direct patient contact and between patients, whether or not gloves are worn, immediately after gloves are removed, before handling an invasive device, after touching blood, bodily fluids, secretions, excretions, non-intact skin, contaminated items, even if the gloves are worn. During patient care, when moving from a contaminated to a clean body side of the patient, after contact with inanimate objects in the immediate vicinity of the patient. So donning and doffing personal protective equipment. So putting on your equipment, the first thing you want to do is hand hygiene, clean your hands. Then you put the gown on, then the face mask, then the goggles, and then the gloves, and you're ready to treat the patient. Removing, which is doffing, you take the gloves off, hand hygiene, put on a new set of gloves, take off the gown, take off the goggles, take off the face mask, gloves, and hand hygiene again. Disposal of personal protective equipment, which is all that material, gloves, etc., gown, etc., after treating a patient. PPE that has been used when treating a patient who satisfies a health protection surveillance center screening case definition for COVID-19 must be disposed of as clinical waste. In a nutshell, if you treat somebody who's feeling sick, you're going to suspect that they had COVID-19. So you're going to treat them all the same. You're going to take the material that you have, all that, your PPE, and you can do two things. You'll put it into a hazardous waste bin. If you have one, which is like a yellow bin, very often in companies, etc., they don't have them. So what you do is you take the material and then you put it into a black bag. You double that black bag and then you keep it for 72 hours before you dispose of it as normal household waste. So just at the end, they're double bagged and retain security for a minimum of 72 hours before being disposed of as general household waste. Respiratory hygiene. Persons with respiratory symptoms should apply source control measures, cover their nose and mouth when coughing, sneezing with tissue or mask, dispose of used tissues and masks, perform hand hygiene after contact with respiratory secretions. So really important section here now, management of somebody who possibly has cardiac arrest. You perform compression only CPR on the patient, no mouth to mouth, compression only. Mouth to mouth and mouth to mask ventilations must not be provided to any patient. So we're going like the American Heart Association system now. There's no ambiguity about whether you should be giving mouth to mouth anymore. It's just going to be compressions. Responders must not place their face, ear, or cheek close to the patient for obvious reasons because of the breathing, etc. You're going to watch, listen, you may put your hand on their chest, look at rise and fall of the chest. So case definition for COVID-19, any patient with acute respiratory infection, sudden onset, at least having one of the following: a cough, fever, shortness of breath, or any patient with acute respiratory infection and has been in close contact with a confirmed or probable COVID-19 case in the last 14 days. If they have a loss of smell, loss of taste, distortion of taste. So you'll be doing this all within your screening. The first thing you need to do is get your patient, take them with a 2-meter distance into a secure location. Once they're in that secure location, you sit them down. You're then going to tell them, I'm just going to prepare myself. So you get your PPE on. Once you've done that, then you can attend the patient. You can start doing the screening. You make sure they've got a mask. You make sure they've got tissues. Try and calm them down, keep them comfortable. But then the screening process starts about how when you're not feeling well, what's wrong with you. Go through, loss of smell, taste, sore throat, coughing, sneezing, any of that kind of thing. So you're trying to rule out. At the end of the day, you're going to treat them as if it's a COVID-19. Responders who are trained to use a BVM may do so, but should ensure a viral filter. So that's a bag valve mask. You won't be doing this unless you're an advanced first aid responder or if you are a paramedic. So you'd have to ensure there's a good seal on a face mask and to minimize droplets. The 2-person operation of the BVM is recommended. As I say, unless you're advanced, you'll only be doing that. And I will actually go into more detail with another presentation if this is what I was giving. But this is for just first aid responders, not advanced or paramedics. Same thing again here. O2 therapy and nebulization should be administered at the lowest appropriate flow rate with a surgical face mask over the mask if a patient tolerates this. Nebulization is a surgical face mask over the nebulization mask if the patient tolerates this. Use of suction equipment, again, paramedics only, must be avoided where possible, particularly in confined spaces. So caring for your suspected COVID-19 patient, infection control standard precautions, provide patient care in accordance with pre-hospital care clinical practice guidelines, You isolate the patient. So that means you bring them to a place where they're going to be away from everyone else. Accompany the individual to the designated isolation area via the isolation route. Keep at least 2 meters away from the patient. Ensure that others maintain a distance of at least 2 meters from the patient. Provide a mask for the person presenting with symptoms. The patient should wear the mask if in a common area with other people or while exiting the premises. COVID-19 specific protocol for responders caring for suspected COVID-19 patients. Facilitate the patient remaining in isolation. Facilitate the patient in calling for their doctor. So they may feel sick. Did they travel on their own into work? Did they use public transport? If they travel into work and they feel well enough to leave, then you make that decision between you and that person. And then when they go home, they're going to ring their GP with their symptoms. If they came on public transport, they will not be returning that way. It'll be a taxi. If they deteriorate, you'll be ringing for an ambulance. You advise the patient to cover their mouth and nose with disposable tissues provided when they cough or sneeze, and put the tissue in the waste bag provided. Make sure they don't keep a minimum to touching surfaces around the area and then as they're leaving. Arrange transport home or to hospital for medical assessment. Public transport of any kind should not be used. Arrange for appropriate cleaning of the isolation area and the work areas involved. Provide advice and assistance if contacted by the HSE. So I've done quite a bit of this already with regard to the return to work safely protocols. And each company now would go into great detail with regard to cleaning. And this would be brought in with management as well about how you're actually going to clean surface areas after somebody's been sick, but just generally in the building because of COVID-19. So to summarize, SARS, NOCOV2 and COVID-19, what it is exactly, how the infection spreads from person to person, how you as a first aid responder can break the chain of infection for COVID-19, infection control standard precautions, hand hygiene techniques, when hand hygiene should be performed, how to select appropriate personal protective equipment based upon risk assessment, how to remove and dispose of single-use nitrile gloves. And just to summarize further, we went through respiratory hygiene, cough and sneezing etiquette. You're now providing CPR for patient cardiac arrest. There's no mouth-to-mouth, it is compression only. The Health Protection Surveillance Centre screening case definition for COVID-19. How the first aid responders can look after their own physical and mental well-being. So we go through this in the course, but if you treat somebody with COVID-19, there's always a thought in your own head that, you know, you may have contracted this yourself. So you may need to talk to another first aid responder or a counsellor or a GP afterwards. Precaution that must be taken when ventilating a patient using a bag valve mask. As already described, this is probably for advanced fire responders or for paramedics. And the same with giving somebody oxygen. Okay, so thank you. But what I'm going to do now is I'm going to see if I can share a video here for you. A new share. I'm going to see if I can pull it up here. Okay, so let's see if I can PowerPoint. Okay, so this is first. I'll just go through donning and doffing here. Okay, so the first thing is, these are the materials you need. You're going to need gloves. You're going to need a gown, a long sleeve gown. It needs to cover right down to your hands. You need a mask, NCVO2, or sorry, an FP2 or FP3, which is like a surgical mask you'll need in the case of dealing with somebody suspected. And you're going to need gloves as well. And then you're going to need some bags to put everything away. So the first thing you're putting on, you clean your hands first. So you either wash them, use a hand gel, thoroughly give them a good scrub. Then you're going to put on the gown. Now, the best ones are probably the ones that you can tie at the back because you could be on your own. If you've got a button one like this, you need somebody to button it up for you. So if it was me and I have one, if I can pull up the video now for a second for you, I will show you. And that's probably what you would be better off using. So then you're going to put on the face mask, like so. And this is one of these surgical masks. If you only had an ordinary mask, you use that. Obviously, if you didn't have an an FFP2 or P3, you would use this. Next goes on the glasses. So we're really stopping any kind of transmission of droplets to the eyes, to the face. Then gloves, nitrile gloves. And then removing. So the first thing we're going to remove after treating our patient then is we pull it down. You can see here, he kind of pulls it halfway down, then the other one halfway down, and then he's able to pull off the rest. Okay, now he's going to clean his hands. So he would have cleaned his hands, then he would have put on a new set of gloves. Of course, again, as I say, you know, you'd want one that you can just tear off yourself a gown. Ideally, gown is removed into a hazardous waste, or, you know, we're going to put in a black bag that we'll bag. Next thing, gloves off. Okay. Mask all together. Clean hands thoroughly, and then everything goes into a double black bag, kept for 72 hours. Okay, I'm just going to see now if I can, sorry, pull this out of here. If I can pull up the video, that would be fantastic for you. So let's just see now if I can, here we go. So hopefully you can see this here. I'd say you can. I'm going to play this video for you now. Hello, my name is Shane McKay. I'm a physical therapist and first aid instructor. I teach CFR and FAR first aid responder training. Today I'm just going to quickly go through with you how to CFR and FAR first aid responder training. Today I'm just going to quickly go through with you how to treat somebody who may have a suspected case of COVID-19 in the workplace. There's now a new protocol procedure in place where you have to put on a gown, mask, gloves, etc. to treat that person. And I'm going to go through for you now. Okay, so we have a patient that's sick in our company, and as the first aider now, we're going to treat that person. We have to take it that this is a suspected COVID-19 case, and it may not be. It could be a million different things, but we're going to consider that it is. So we should have a protocol in place how to treat the person. The first thing you need is you need a designated room that you're going to bring that person to.
Just checking it's working.
It should have windows, and it should be airy, well filtered. You're going to have to provide that person with a mask and tissues. First thing you're going to do after you bring them into the room, obviously keeping a 2-meter distance, is you're going to don your equipment. First thing we're going to need is a gown. This is what we're going to put on first. So what we need is a long sleeve gown. Pop it on like this. Now, this one is a tie-on one. Some come with a button up, but the problem with the button ups is you need somebody to button it up for you, and you could be on your own. So I would probably go for something like this. Okay, so now I have this on. So the next thing I'm going to put on is my mask. Okay, so which one is an FP2 or FP3? This is just an ordinary mask because I'm waiting on them. They're in short supply. But an FP2 and FP3 is a more surgical type mask is what you need. So there's a little bit here that kind of bridges around the nose, a metal bar, so you're going to put that on, put it around my ears first. And then I've got to squeeze on like this, okay? So then glasses, big on protect my eyes from droplets. Then our gloves. So these are nitrile gloves. You can use powerless, you can use whatever you want, as long as they protect you. So now I've got all my equipment on, I'm going to treat my patient. And once again, this patient has been removed from wherever they were feeling sick, keeping a 2-meter distance in mind. I will provide them with tissues, I will provide them with a mask, I will then go through a screening process, asking them how they got sick, when did they start to feel sick. I should point out as well, if anybody's feeling sick in the morning before they are coming to work, they shouldn't come into work, full stop. Night before, do not come into work. That is the protocol now in the workplace. But this is a case where somebody's just suddenly felt sick and you have to take it that it possibly could be COVID-19, not necessarily. So after going through the screening process with them, I'm going to treat the person for whatever it may be, okay? Even if it's a cut finger, I'm still going to make this process because we just don't know. We're getting close to the person, so that's the issue. Once you've done that, once I've got all my equipment on, I then need to get rid of all the equipment. Now, I will only get rid of all of this once the person no longer needs any more treatment and that they've been removed from the building. With regard to removal, it will be a case if the person is driven in on their own and they're able to drive out and they're well enough to do so, then they might get back into their own car. If they're on public transport, if that's where they came in to work, etc., they will not be using that. They will either use a taxi, or if they deteriorate, they will use something, an ambulance will be called. So now, the next part is to actually get rid of all this equipment. So what I'm going to do is, the first thing I'm going to do is I'm going to get the gloves. So what we do is we pull them down like this, sort of halfway, like so, and then what I can do is I can grab the other bit like this. So it's turned inside out now, and I can pull that there. So I'll put them into a black bag. Now, if you don't have a black bag, some places will have a yellow hazardous bin or hazardous waste. A lot of companies wouldn't have that. So use a black bag. I'll put all this equipment in here. But what I'll do is I'll bag it again with another black bag and keep it for 72 hours and dispose it as normal. Okay, so now what I'm going to do is, after removing those gloves, I'm going to clean my hands again. Try and get all your fingers or your thumbs. Just to be safe. Now, I've done another pair of gloves. Take the rest of the equipment off. This is how we have to do it. Just tear this one off like so. Glasses. Mask. Gloves off again. I'm going to do my hands again. And what I can do is after this, I'll go in and wash my hands thoroughly then as well. So now I have everything in the bag here. What I'll do is I'm going to put another bag around this and I'll tie it up again. This then is left for 72 hours and then can be disposed of as normal. As I say, if you've got a yellow hazardous waste bin, you can use that. A lot of companies wouldn't have that. So that's donning and doffing in the case. Okay, so thank you for that. That is the recording.
Are you good to go with our new range in Argos? You can also get our lowest price ever on this Motorola A6 Plus for $79.95.